One chronic illness that's showing no signs of slowing down is obesity. Nearly 2 in 3 Australian adults are overweight or obese. In children, it's 1 in 4. Severe obesity, that's a BMI over 35, is linked to conditions including type 2 diabetes, high blood pressure, and fatty liver disease. And a recent study has shown bariatric surgery, an increasingly common surgical treatment for adults with severe obesity, is just as effective in teens and may even have additional benefits, as Tegan Taylor reports.
After gastric bypass surgery, the stomach is reduced to the size of an egg and the small intestine divided and replumbed, dramatically reducing the amount of food a patient can eat. It's drastic surgery, but it's one of the most effective treatments we have for big, long-lasting weight loss. And a new study suggests it should be more available for young people.
The gastric bypass in the teenage group and gastric bypass in the adult group produced almost identical weight loss. There was no statistically significant difference between the two, which is reassuring.
Professor John Dixon is a senior research fellow at the Baker Heart and Diabetes Institute and one of the study's authors. The study, published in the New England Journal of Medicine, compared the effects of gastric bypass surgery in teens, who were between 13 and 19 at the time of surgery, and adults. All the patients in the study were followed for 5 years after surgery. Both groups lost similar amounts of weight, but the teens were much more likely to have big improvements in blood pressure and type 2 diabetes than the adults. This is an important result, especially considering type 2 diabetes is a more severe disease in young people.
Those who develop type 2 diabetes as adolescents have an awful disease. It rarely reverses or can be treated effectively. It progresses more rapidly than when it occurs in adults. It seems to be a more aggressive disease. It's come on early and it seems to be more aggressive.
Many studies have shown bariatric surgery is one of the most effective forms of dramatic, long-lasting weight loss for adults. Professor Dixon said this study showed it should also be an option for severely overweight adolescents.
The health outcomes are amazing, not just what we've mentioned in diabetes and in hypertension. We see extraordinary improvements in quality of life. The sleep is so much better, daytime sleepiness, the ability to concentrate at school, the ability to concentrate at university, it dramatically improves.
The study did uncover some less positive results. More of the young people needed follow-up surgery and they had lower iron and vitamin D levels than the adults. But Professor Dixon says, on balance, the operation is safe and often life-saving.
The risks of the operation are very small in younger people compared to the benefits of the operation. We need to treat you now, not later, not leave it till you're now 18 or 20 or something like that.
But it's tricky for Australian teens to access the surgery. In Australia, weight loss surgery is a specialty practiced almost exclusively at adult hospitals. In the public system, this often means adolescents can't be admitted where the surgery is offered. George Hopkins is a Brisbane-based bariatric surgeon.
This field of bariatrics is a subspecialty, and that subspecialty exists in the adult world at the moment, and it doesn't exist in the adolescent paediatric world. There's no skill set there. Every level of care, from the moment you walk into the hospital to the moment you leave, and then including follow-up and outpatients, all has to be done in this sort of cross zone between the adult world and the children's world.
And he says while the teens who are candidates for this surgery are often living in adult-sized bodies, they're still children in many ways.
As an adult surgeon, I don't usually have a consent issue. The consent is, as an issue, a big highlight of the difference. Even anatomically, children and their airways and their anaesthetic recovery is different to adults.
Barriers to teens accessing bariatric surgery go beyond just hospital logistics and physiology. Catherine Steinbeck is an adolescent medicine expert at the University of Sydney, and she says severe obesity and socioeconomic disadvantage often go hand in hand.
Up to 70% is due to what mixture of genes that you have actually acquired, which is a bit hard. You can't do much about that. We also know that there's a very strong socioeconomic gradient, so that there is something about adversity and poverty and stress and housing conditions that all play in to making the effect of the genes worse.
And where there's socioeconomic disadvantage, there's access problems when it comes to health interventions, including surgery.
But what really worries me is that there is no money in the public purse for this sort of surgery. Well, there's very limited money. So we have this gigantic, complex access problem. Every patient that I see, I can only think of one or two in decades that have been able to afford it.
Bariatric surgery is often seen as a drastic measure in the community because the majority of surgeries are performed on people who can afford to pay for it privately.
It's seen as a cosmetic thing, but we're talking about people who have great medical and social needs as well. Consistently, obesity is stigmatised as a personal problem, something that people got themselves into. It's the situation we're in with mental health 30, 40 years ago.
John Dixon hopes his research will help shift public perception and health policy.
We shouldn't ignore our children. We shouldn't be giving them second-rate treatment. That's one of the best treatments we've got for such a disabling and serious disease.
Professor John Dixon from the Baker Heart and Diabetes Institute, ending that report from Tegan Taylor.